I'm Vicky, I'm the director of Peer Hub, and I just wanted to say thank you for tipping up on a Wednesday night. We're recording, just let people know that we keep trying to record the webinars, and it always seems to be one of those admin things that falls away. So we are recording tonight. I'm going to introduce you first to our lovely speakers who've joined us, and then we're going to talk about well-being and COVID and work and what's really going on out there, really, I guess. So rather than cause it further ado, I think I'll just start with who's on my screen next, and that is you, Steve. So if you want to just like introduce yourself and tell us a little bit about yourself and
Sure. Hello everybody, I'm Stephen Ollis. I'm a psychologist who is currently working at the University of Teesside as a lecturer on the counselling psychology doctorate. Previous to that job, I worked in the local health trust, which is where I met Vicky, and part of my role was within the trauma-informed care programme, which had a bit of a focus on tonight's topic about kind of staff well-being and kind of finding ways of navigating through work. So yeah, I'll pass back.
Thanks, Steve. So the next one, so Sarah Price, we share a surname because we share parents. So Sarah's my sister, and I'm just want to let her introduce herself because I can't think of anything kind to say about you, Sarah. So you better find something.
Oh,
this is my sister. She's the strategic director, managing director, founder of Go Well. Go on, Sarah. Go on, sis.
If we're starting like that, this is going to be fun, isn't it? This is the first time we've shared professional space live. So yeah, get your popcorn. So my name's Sarah. As Vicky said, I'm the manager and a director of Go Well. We are a community interest company that predominantly works in education. And we, like my lovely bit of Brandon behind me says, we create innovative educational programs that really try to maximise the power of movement to improve wellness. And in an education setting, that looks very much like physical education, school sport and physical activity. So we try to use those as tools for more than physical health. So we use it as tools for mental health, around personal development as well, so building skills and values, and around cognitive function. So we know that doing activity creates more brain cells, it makes you more alert, it helps you to concentrate. So it has a real function in education to help children to be ready to learn as well as lifting mood, which is a lot of research into as well. So we're trying to use and maximise movement as much as we can for the development and well-being of children in schools.
Thanks, Sarah. And I think one of the reasons as well why I'd asked Sarah to come on is some of the stuff that she puts out with Go Well is like, it's quite focused, kind of short, easy, accessible bits and pieces. And I wanted Sarah to have a bit of a chance to talk to you around how they make stuff accessible, particularly at the moment with COVID. So that's why she's here. And next on my screen, I've got Hannah, who I worked with back in my policing days. So I'm just going to ask Hannah if you can introduce yourself, please.
Yeah, hiya, I'm Hannah Bell, and my business now, having retired from the police where I met Vicky, is I have my own company, which is Hannah Bell Clarity. So I deliver workshops, one-to-one sessions, supporting different organisations with how to understand their brain better. So it's well-being, resilience, and I blend together psychology, neuroscience and neuro-linguistic programming. So there's lots of different elements that I can either deliver just on a one-to-one or a one-to-many kind of workshop. I'm passionate about well-being for our children and young people as well, which is where I met sister number 2, Sarah Price. I was introduced to her when we started to work together and collaborate with my brain stuff and Sarah's physical activity. And we developed a programme that's been really successful in schools now for a number of years. And recently I've just had my very first book published, which is called The Brainy Bunch, and that is all around supporting young children, parents, carers, anyone really to understand their brain and emotions and bring into life through some quirky characters, different elements, parts of the brain and different chemicals. So yeah, it's been a busy few years since Vicky and I worked together for the police.
Hasn't it? Yeah. And the Hannah, I don't know if you want to drop your link in for the Brainy Bunch book into the chat, but I think it's some people are probably interested in.
Yeah.
If you've got it, if you want to drop it in the chat.
Yeah, I will do.
Yeah, great. Thanks, Dan. And then finally, we've got Angela. So Angela, I worked with Angela when I worked for the NHS, but also Angela hosts a online music group on a Thursday night, Connection Through Music, and she kindly invited me to play on a couple of occasions. So that's another way where Angela and I have connected through the music. So I asked Angela to come along and talk a little bit about that and also about some of the work that she's done in the NHS. So Angela, do you want to introduce yourself?
Yeah, so Angela Kennedy. I've worked in the NHS for an extremely long time as a psychologist, and surprisingly, my very, very first project back in 1990 was to look at the therapeutic value of work in one of the big asylums in the region. So it feels like this come right back full circle, Vicky, so thank you for asking me. And yes, I am a passionate advocate for the arts, and they have a really big role in my well-being. And so we've been doing some well-being music events, which mixes music and well-being messages every Thursday night, and Vicky has helped out with some of those, so thank you, Vicky.
It's a really lovely connecting group, isn't it, Angela? It's a really nice kind of...
It's a really lovely, safe group from around the world. It started off for NHS staff, but became something else very quickly. And yeah, we use music to help people connect together. And I've labelled it as artistic resistance against the cultural void, social isolation and fear of the pandemic. And I think it certainly has been that for me. It's been the only day of the week that I know what day it is, because it's Thursday and it's music.
I've had a bit of a struggle with that today. And I actually, one of the things that I wanted to talk about is about how much of a focus there's been on well-being and how very individualized that focus has been during COVID. And I guess kind of like starting with the music group and how you've built the connections around there. I just thought maybe starting with you, Angela, around like that, how you managed to bring people together when there's such an individual focus, I guess, at the moment with lockdown.
Well, in our society, we have a thing that sees individuals as individuals, and within other cultures, that concept doesn't really exist in the same way. And I think whilst that can often give us a sense of autonomy over our actions and everything, the downside of it is that actually it locates a lot of both the strengths and the problems as inside of us. But actually we are very adaptive creatures, and we adapt to our environment, in particular our social environment. So what is going on with us inside of us is quite often triggered by what's outside, and vice versa. We can also trigger things in other people. I mean, that's the basis of empathy. It's often the thing that is considered most human. So the music was an attempt not just to, dredge up all the old kind of very stuff just about people not coping, and find a way of celebrating the best of our humanity to help our well-being, something that's much more strengths-based, something that's much more positive and life-affirming, in a way that just pulls people together, rather than pushes it as a problem, and secondly pushes it into individuals as a problem. So I think what's really amazing about it is that the four of us who do it come from quite disparate backgrounds, but none of us could have done it on our own. And it's certainly, if you look at what's produced from it, it's certainly not just the equal sum of all the individual parts. Something has emerged that is different and bigger than the sum of its parts, and that's what true human collaboration is about. That is what well-being is about. It emerges from our connections with other people. And have a bit of a problem with simply seeing resilience as being inside of us, because it isn't.
Yeah, and I think that's certainly being like a peer-led organisation that does peer support. I think that is the thing that we're always working towards, community stuff. And I guess so. I'm gonna go to Sarah, because I think sport is typically seen as being something that people do together, and then obviously with COVID, like, there's been a lot of restrictions on how people can do it together, and your organisation's really turned some stuff around, and also like with your staff as well, like how you've been able to keep that sense of team and togetherness while people have been separate through the work that you've been doing, I guess.
Yeah, so I think we knew that we had a big role to play during the pandemic, because we knew how important keeping people active was, or encouraging people to be active and move as little or as much as possible, I guess, just doing any form of movement. And in our team, we like to do joint challenges. So we set up a Strava group as a team, and we would have little challenges to travel, like to John O'Groats, or we'll go across Europe. And Paul in our teams, really engaging and inspiring, and he would send us pictures of where we were along the way. And that was really good to bring us collectively as a group, but we shared that with the schools that we work with as well. So teachers would join the group, and we would have that collective journey somewhere. And we did one which was 1,000,000 steps to wellness, which really grabbed people's attention and helped people to get out. That one time you could go out and walk, you weren't doing it on your own, you were doing it as part of a group of other people that were all working together to get to 1,000,000 steps. So I think we had about 30 groups separately working towards 30,000,000 steps, but collectively having updates and having that social connection through, say, the Facebook group, the pop-up Facebook group that we've made for that. So I think it's around, there's still ways that we can connect, and the forces are very much against us, and it's harder to connect, but there are still ways that we can do it through events like this, through social media, through doing workouts with, so I struggle to work out by myself, and I've found January and February particularly difficult because it's dark, it's cold, there's not as much light. And in lockdown too, I was going and meeting a friend at the park and working out. I've really struggled in January and February. So I think it's just reminding people that it can be done in a Zoom sort of situation, and it's very difficult, but the more you can move, the better, because of how it lifts mood. And I noticed in the chat, so if people would like to put in the chat things that really help with their wellness at work, there's a couple of examples already in there, but a good few of them are around exercising, which was good to see, and getting out in the daylight is so important. So I think, like what Angela said, how we can bring people together. So I could count my steps and try and do 10,000, 15,000 a day on my own, but it felt so much better doing that as part of a group. And similar with the resources that we put out for children as well, they're doing it together as a class. So their class are doing, say, our Go Find a Jar that's out at the moment, that's got a physical activity every day and a wellness activity every day. So children are doing that collectively with their families, but also they're sharing that in their school learning packs as well.
Yeah, and I mean, one of the things that I find quite interesting is around the kind of like the size of the groups that are coming together as well, because it feels like where there's a real community and people are like getting to know each other and talking to each other, rather than having like a big event type thing, like just people collaborating together, connecting with each other, learning about each other. It's that personal side, isn't it? And Steve, I wanted to like bounce to you. This might feel like it's come a bit out of the blue, but I know we've talked a little bit about like the reality of it versus kind of the like what well-being really looks like for like if you've got a family or if you've got a busy life, versus this kind of like idea of, you know, you stand on top of a mountain doing yoga. Like I wasn't sure whether or not like there was something around some of our conversations we've had around what you've learned about well-being like in the real world.
Well, I think my experience of how well-being is used in the workplace is I think it's seen as kind of things that you do and things that you kind of advise to do. And some of those things are things like exercise and mindfulness and what have you. And I just think, I don't know how effective that always is as a means of encouraging people to actually do those things sometimes. I think people have to kind of find their own way a bit, rather than kind of being almost shamed sometimes into not doing certain things at certain times, because I think a lot of the things that people recommend for well-being you actually, you need certain resources and privileges to be able to do them. So yeah, I just think, well, I agree with kind of Angela that it's about the structures that work put in place for people to be able to. So a good example I was thinking there when you were talking, Sarah, was I agree that going outside and getting fresh air and having daylight, there's been days during this lockdown where I've just not done that through work and just almost forgetting to do it. And I think an employer should be actively, if not saying here's some exercise classes to join, which people won't join, but setting up to make it very clear to their staff that it's okay. You don't have to kind of hide. Sometimes I'll go for a run during the day and I'm like, do I save that on any like Strava or anything like that? Because will my employer be watching, or will someone see it? Which is ridiculous. But I think especially during the dark months, where people can't go out at night, it'd be good if an employer said, right, okay, take an hour off during the day and we'll support that, and don't worry about making that back up. And I just think that Angela asked in the chat, what would be a good way of showing that you're valued? Well, that would be a good example of it. And I don't think you'd be less productive. I think you'd be more productive in doing it that way. So it's about kind of the context as much as anything.
I think there is something really in there about, like, it almost feels sometimes that wellbeing becomes a chore when people are and some of the schemes that are funded for workplaces are like, well, we'll give you an incentive if you'll do wellbeing the way that we want you to do it. And I think there is really something around like that kind of creativity and allowing people to find their own thing. And I remember seeing, Sarah, one of the things that you'd done on Strava, where people were drawing pictures on Strava as they were running and that kind of thing, or walking or whatever. I'm going to come to Hannah though, because Hannah, I mean, I think a lot of the stuff that you do is really personalized and really about the person who you're working with and supporting. So just that, like, how you adapt your style for the people who you're working with and the different things that you use to help bring out themselves through what they're doing.
I think that mindfulness is absolutely brilliant for some people, and I think that some organizations think that they can cut and paste a few TED Talks and offer a few workbooks and think that they've done their bit. But creating that space for employees to, let's say, have, right, every lunchtime by 12 o'clock, I don't want to see anybody logged on. Because I think that a lot of our identity in culture is fixed around how busy we are, how important we are. So we get that lovely chemical boost by thinking, right, I've achieved loads. So there's so many people that I'm supporting currently that are working even more hours than they should be. And they're scared to even let their mouse stop moving in case their boss thinks, a little bit like what Stephen was saying, that their boss thinks that they're not being productive. And I think we've got to get away from glamorizing, like, not looking after yourself and being a kind of work, like a real workaholic. And I think disconnecting from your space or wherever you are, even if it's just to have regular brain breaks, just to stand outside, just to have a cuppa, and then moving back, that you create those habits that then form in as muscle memory in your brain, so that your body then tells you after a little while, right, you've not moved for a bit. Because I do think that my worry is that we won't really go back to big offices and big call centres and people working together again, because employees have realised that productivity-wise they are getting, if not more, work out of people, but to the detriment of their own well-being, that they're not being cared for.
I think what's really important though is that productivity and well-being go hand in hand. And taking things out, time out for well-being isn't taking things out that would get in the way of productivity. It actually helps it, and all of the evidence is around that, or whether it's in the NHS or other organizations. And I think the things that you're talking about in terms of how the systems are put in place to enable staff to do that, and the expectations, the kind of general expectations, do help all of those things, because it's only by creating the culture can you actually make those things happen. I mean, I certainly am finding physicality, or the absence of physicality of just sitting in front of a computer all day, really tough going. And I'm generally a fairly sedentary person, but it's really hard. My knees are swelling up, my eyes are getting sore, and you're absolutely right. The meetings are put in back to back without even time to stand up between them a lot of the time. And that kind of culture is really going to pay back on our performance targets massively, because we're working hard and longer, but we're not necessarily working more effectively if that's all we're doing.
Yeah. And I think there's something around like big organizations and the kind of like the mass message that goes out when you've got a lot of staff, and then the difference that you can, what the different things you can do and how more adaptable you can be if you're working for either a smaller organization or if you're working for yourself. And I'm just going to chuck this back to Sarah, because when Go Well moved to doing their remote work, I know, Sarah, that you did a lot of stuff with your staff to help them make their workday work for them as well as for you. And I thought with being a smaller organisation, you've got a bit more flexibility, but I think there's something in there to learn from that around like devolving stuff to line managers and to team managers around support and well-being, so you've got a small group. So Sarah, I don't know if you've got something around like.
Yeah, no, totally, because sometimes I feel like I live in my own little bubble, because when I hear people saying I wouldn't go out for a run during the day, or I'd be scared to like log off my computer for 10 minutes to go and have a cup of tea, I'm like, pooh, like that. Like if I ring my member of staff and they're out for a run, I'm celebrating. I'm like, yeah, that's great. You continue your run and you give me a call when you get in. So we're really flexible with our working hours with our team, especially with people with children at home and homeschool and all the stress that people are under at the moment. So as soon as we went into lockdown 1, it was a case of your health, your mental health, your health and your family's health is the most important thing at the moment. Go and find out how things are going to work for you. Let me know when you might work or might not work, and we can have a discussion. I want you to look after yourself as best you can, so you don't need to clock in at any time, you don't need to clock out at any time. I want you to exercise during the day. One of the key things for this lockdown, knowing that it was winter, was I want my team to get outside during the light time, during the day when it's light. And I think something Stephen said about earlier on in the chat was that well-being at work is being valued by your employer. I completely trust every member of my team that they will do the best they can in the circumstances that they're under, and they want our business to do well. They're not going to destruct anything or cause problems. They want us to do well, but they also want to be well at home and spend time with their families and make sure everybody else is okay. So I've let people set their own work programs. I've encouraged people to be active. We have drop-in cups of tea during the week, like digital drop-ins, just when work isn't on the criteria, and we just have a chat, and we have some monthly-ish socials on an evening, and there's no pressure, and I think that's really important. There's no pressure, so if you don't come to a coffee morning, that's fine. If you don't do one of our Million Steps challenges, that's fine, because it has to be a personalized approach, and people have to be able to make their own decisions about what works for them, and only they really know what works for them. And as an employer, I can give them opportunities, and I can build a bit of structure, and I can set some boundaries, I guess, as an employer, of my expectations. But I'm working with human beings and I'm working with adults. I trust them to make good decisions.
And I think that's the thing when you've got a small organisation and you know the people who you're working with, that's an easier thing to achieve, to be able to say. And sometimes I think when organisations get bigger and the blur that becomes like the different departments and the different levels of staff and the lack of personalisation, sometimes I think that there's sometimes it's harder to kind of to have that sense of trust that you have with a person and not necessarily with like a group.
So yeah, isn't it? It's like fear of the unknown. So what if I deconstruct this structure that I think has been working for me, and I give more freedom to my staff? What will happen? Will it all fall down? Will productivity drop? Will people take the mick a little bit? But I think if you're clear with your boundaries and your expectations, one of the key things for us of how this has worked is communication has been a key thing for us. So we just want you to keep in touch and let us know how you're doing, what you're up to. And I think I only ask my team to email me twice a week just to say, this is what I'm working on, this is where I'm at. Whereas I know other organisations, you've got to be logged in at a certain time and you've got to be online for so many hours. And I couldn't tell you how many hours my team worked last week, but I could tell you what they did, and that's more important to me.
Yeah, and I think it's what we're doing, isn't it? Not how long we're taking doing it, and it's what we're trying to achieve. Is if you're trying to achieve an outcome, then it doesn't matter. It doesn't matter as long as it's done on time, does it really? So I just want to come to you, because I've noticed that you've just popped into the chat there about it was around the percentage of was it HR? You just popped.
Sorry, did you say Fee? Was it me?
Yeah, Fee. Yeah, you, Fee.
Hi everyone,
Yeah.
nice to meet you.
Do you just want to introduce yourself for a second, because I'm quite interested in that, and then we'll talk about a little bit.
Yeah, that's shocking, isn't it? I'm Fee Hills from Virtual Coffee House, and I really focus more on digitizing well-being in the workplace and creating really what you'd call a sort of scalable learning, they call it, but it's really like a well-being culture. So that's my work. That's how I know Hannah.
Yeah. And it looks like you've been doing some research around relationships of trust in workplaces, and
yeah, it was shocking. I did, because we were getting like large scale investment for the technology and stuff, and they made me do absolutely loads of research, and we had to sort of interview 100 HR directors in sort of quite sizable companies, really corporate and mixed, big, medium and mixed, and 97 out of 100 companies, so it was 97%, equal the top problem challenge they were facing was trust. Now, I don't know if that's changed during the pandemic. That was just prior. It was a month before the pandemic, came into effect.
And I wonder how much of that is to do with, because you said HR directors, didn't you, there?
Yeah. So that was the HR function. What's your biggest problem? Blah, 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 etc. And the one they saw for 20, so that was like at the beginning, so it would have been like December and January of the year. They said that the biggest problem they had, I was shocked, to be honest, because I didn't expect them to come out with trust, but it was 97 out of 100.
Yeah. And I wonder how much HR now is focused really on like the regulation of employee behaviour rather than development and support of it, like in big companies.
I think right now, what we're finding now is the biggest initiative and challenge, if you want to call it that, is for them is well-being.
Yeah.
So engagement's gone, which, and I'm not saying it's gone. I mean, it's not at the top of the list. And the top of the list is definitely well-being initiatives.
Yeah. And I think
how do I fix that?
Yeah. And I think it's difficult, because I think when there's been particularly in big organizations that are most likely to have HR departments rather than smaller organizations that are more likely to do their own, there's a lot of kind of like constraints around things like sickness absence, or like a bereavement leave would be X amount of days, and it seems to be quite regulated. And I'm just thinking, I'm going to come back to you, Hannah. I know this might sound like a strange place to put it, but I remember working with you in the police, and the leadership stuff that you did then, that was a much more kind of like appreciate that everybody's different, and everyone's like, I'm thinking about the pack type stuff that you used to do, and like how you build a team from bringing together people who are different. And then doesn't that then also mean that you need to treat staff more as individuals and have flexibility around well-being and stuff?
Yeah, and I think as well that it's a bit like you've got like your kind of well-being toolkit, and it's encouraging people that they might try something and think, right, that's not for me. Then it doesn't mean that everything's out the window. It's about different things that you can do to encourage people, but understanding that everyone is different. Lots of introverts that I work with absolutely hate being on Zoom or Teams or anything like that, because it's as if that they're on show, and it's as if it's a performance for an hour. So even just saying, right, do you know what, we don't need our screens on, we'll just do audio. And in people's voices, when it's natural, you get a lot more emotion and kind of probably thinking, I'm not sure that they're right, more than the screens. So feeling valued, thinking, right, I know why that we're not having screens today. It's because my boss knows that makes me a little bit anxious, or a little bit nervous about meetings or speaking in meetings. So it's little tiny things that you can do, having that self-awareness as a leader or even as a colleague, that makes people feel really valuable, really cared for. Even remembering the name of the children or their dogs, it's understanding that kind of leadership journey that person's been on, and the reality of what is life like for them. I've had some meetings where someone's been so stressed, the dog's doing the wall of death because it's not been out, the kids are absolutely running riot, the weather's bad, they can't get outside, and this person is sitting there still having to deliver exactly the same as if they were in some lovely office somewhere. And I think that we need to treat people as individuals, and to really understand that, like Sarah said, give them so much more room to create that space to connect with themselves, rather than timesheets and logging off, because you will get so much more out of them, and they're going to be happy, and then they're going to want to stay working for you.
Yeah, and I remember some of my colleagues talking about just feeling really good working early in the morning, and feeling really good working late one in the evening, and feeling I had to work 9 or 5 because those were the hours. But actually, if they'd had the middle of the day to themselves to go off and go for a bike ride, or go in the bath during the day, or have a snooze, which is my favourite well-being activity, if I'm honest, is a good afternoon nap. Like that, those kinds of just having that freedom to be able to say, well, actually, I can do it in the evening, is can be quite helpful. So I just want to let people kind of pop the hand up or drop into the chat, and I really want to talk about what's actually working, and aside from what we're being told to do, which is kind of get up once an hour for 5 minutes and have a stretch, and have a drink green tea and do yoga and all that stuff. What's actually working? I know I can almost feel, even though I can't see, I can almost feel Sarah going, but it is good to have a stretch once an hour. Yeah. But so drop into the chat, or we can have a bit more of a conversation about it. But I just want to come back to Angela, because obviously, Angela, you ran the TIC team, the trauma informed care team, thinking about staff well-being, and about how what people bring to work really affects their relationships with the people who they're working with, whether it's colleagues, or whether it's customers, or service users, or whoever. And I just think kind of those working connections, even when they're really meaningful, can also have a massive impact on how valued we feel. So I just wanted to let you have just a couple of thoughts around how you try to bring that into the fore.
Yes. Well, we're not robots, are we? I think that's the thing. And we're not just producers of work. We are real people with real lives, and our lives will impinge on our work and life, and our work life will impinge on our home life. These things interact, often in a very good way. I certainly know that I like my job, I find it rewarding, and I know that helps my home life, and vice versa. But the thing about trauma-informed care in services, it's not just about the people who come to mental health services with abuse histories or whatever. Everybody brings with them a context in which their well-being is placed, which is a two-way street. And you certainly can't think about trauma-informed care as just being something that you deliver from staff to the individual who's deemed to be on the receiving end of that abuse or trauma. What needs to happen is that you need to take a view of, we are people in the context, all of us, and that this is an interaction, and that if you don't look after your staff and the systems that enable staff to be able to have difficult conversations, to be able to think about people in their context, then that is not a trauma-informed organisation. Therefore, those staff can't deliver what you need them to be delivering, because they're not on the receiving end of it themselves. So whether it be trauma-informed care or compassion, what you need to deliver is to be on the receiving end of it yourself, and to have leaders and systems to support that practice. And only through focusing then on staff well-being and the interactions between us as humans really makes a difference, I think, with that. We did some really interesting learning from lots of examples of trauma-informed care, and leadership, and particularly in terms of compassionate leadership, really fell out as one of the most significant of the 7 themes of what actually keeps this implemented.
Yeah.
So yes, a really important aspect of wellbeing. Of course, because of COVID, we now have a whole additional situation where a lot of our NHS staff are facing death rates that they wouldn't usually face. They are having to make sometimes very difficult choices about who gets the beds on the most, in the wards where they get most looked after. It's really tough going. We see waiting lists of, for example, eye surgery going up. How are staff managing that challenge to their sense of value and purpose? And the worry is, of course, that that will be stored up over time, and we'll have a lot of staff burning out or ending up with some kind of post-traumatic stress problem. And we need to put things into place now that will help mitigate against it. A lot of it, though, is about good operational delivery, or having that as good as it can be.
Yeah.
Keeping staff connected, giving staff, as you're saying, permission not to be okay always, and certainly for that not to be pathologized.
And I almost feel like, obviously I'm not working for the NHS now, but I almost feel like the pressure on NHS staff and the fear of the public around what's going on in the hospitals is almost like dividing the NHS from the public. So those community kind of relationships that we would have before with NHS staff who were working on a ward and who would be seen as like, I'm not saying that we don't see this really valuable, because we do, but who would be seen as part of our community. It now almost feels like there's a wedge being put between like the ones who are working in the COVID wards and working really hard, and the fear of the virus, and people feeling really kind of like grateful but then also not wanting to trouble the NHS staff. And there's this big kind of feeling of tension and stress on their behalf that's almost separating them from the community.
But there's all kinds of conflicts. I know somebody who is a frontline nurse, and they were more stressed when they weren't on one of the COVID wards, because on the COVID ward, they were in full PPE. Mm-hmm. On the non-COVID ward, on the non-high intensity dependency wards, you still had huge numbers of COVID patients, but you weren't in full PPE. So not only were you more at risk, your family were more at risk, and you were more at risk of passing it on. Mm-hmm. So often the conflicts and the subtleties of the conflicts that all of this raises is very individual to the person. So I haven't said, a lot of this is very collective. Mm. How individuals make sense of their unique circumstances is very individual to them. And you can never, surprisingly, never assume what might fall out as being a strength for one person and a weakness for another, or one person can flourish in a situation while another kind of really flounders. And that stuff is where all of those interactions come together to create for that person a very unique situation. That's why, anything that's very rigid is never going to help the well-being of all of our staff.
Yeah, absolutely. And I think I'm just going to speak pop this over to Steve, because Steve's you're working for a university, which is another big institution and another kind of area that's been really focused on in like in the news and stuff around something that's been affected by COVID, and the way that people are well, just carrying out your daily business, really, I guess. And my question is more around like that sense of community, and how do you develop a sense of togetherness when you're lecturing and stuff. Like, how do you bring that together in a different way when there's been so much focus on like COVID in student halls and all that kind of stuff? Like, how are you doing that with the work that you're doing directly with the students?
It's really hard to be honest. I was in a meeting this afternoon where the discussion was about how do we get students to engage more in online lectures, because we just find that they don't engage much at all, and that's a kind of a consistent thing. And what's actually happened is it's got gradually worse over the pandemic, and I think, without wanting to get too political, one of the problems is that obviously all the students have come in and they've had to go online, and then they've come in for a bit more, but it wasn't a very pleasant experience teaching in person because everyone's in masks, everyone's sat miles apart, no one can see each other's faces. You had to kind of come and go and not sit around, not hang around afterwards. So it's just been a really rubbish experience, I think, especially for someone coming away to university for the first time and missing out on all of the kind of the fun stuff, I guess. So I don't think it's been done particularly well, and not that that's a criticism of any of my colleagues or the university. I just think they were put into a position which was really, really difficult, and it's been tough. You know, the things we've tried, we've tried to do things, but there's only so much you can do. And I think because the government have kind of left the universities to get on with it, you know, the universities have been put in a position where they've had to keep going. There's been no opportunity to kind of offer money back or let students take time away. And I just think that's led to problems in terms of the student experience and the workload for staff. So I don't think it's been a healthy environment, really. I mean, I suspect there's lots of places of work that aren't healthy because of a pandemic, but it feels particularly intense in the academic sector. So yeah, there's no magic. These are the amazing things we've done. I don't think it's been a very positive time.
You know, and I was just thinking about when you were talking there about like your usual kind of like first year of university, and just like the amount of kind of time that you'd spend in the pub rather than the library.
Yeah.
Like,
what's a pub again?
Yeah, I know. And that, but then I was also thinking like it was already quite a big culture shift to go from school to university. Like it was quite a dramatic change and a lot to get used to. And but I imagine that for students who've kind of done that, like gone to university for the first time, but then it's been a remote kind of way of doing things, that it's even more of a, because a lot of how you get by in university with that big change is with your fellow students. And I know it's a bit of a tenuous thing, but I'm going to go to Sarah though, because Sarah obviously like is doing a lot of her stuff in schools, and schools is always like in person together, and then like all of a sudden, like, you know, there was the debate, are schools going to be open or they're not, and then they're not open. But a lot of kids learning is together with each other, social stuff. And I'm just thinking about some of the stuff that you guys did, because you moved quite quickly at the beginning of the pandemic to make sure that children weren't left behind. And I thought there might be some stuff around that you might want to talk about, around the little people, and also because little people have appeared in our chat as being that's going through the chats about kids on Zoom calls, which is always like I mean, I don't have kids, but I've got a dog that likes to whine. She's being very quiet tonight. But yeah, just the idea of like the social side of learning and how you've managed to figure that out.
Yeah, I mean, it's difficult because of all the sort of safeguarding things around schools and being in the same sort of Zoom call with children in their homes. There's things to overcome, but when teachers have been able to run live lessons and get their classes together through that, we've provided resources that help them to deliver a physical education lesson through a live Zoom session. So there will be videos of our coaches introducing the start of the session, giving the children instructions, and the instructions would work whether they were in school in their key work groups or whether they were at home with their parents. So being able to quickly turn that around and get videos out there. What we found really good in this lockdown is we thought we would do something a little bit different, because, you know, the whole world has pivoted and the whole world has gone digital. So it's now not new as such to have PE videos that people can do or have YouTube videos that people can follow. So we looked at the problem as parents are really stressed at home. Children are finding it hard to engage in their learning and stay on task for a period of time, taught in primary age, because that tends to be what we work with. So what can we do that, and fun, people have almost forgot how to have fun sometimes, and I can totally understand why that has happened. I feel like it's happening to me, that you've got to really push yourself to get out there and have some fun. So we wanted to create something in this lockdown where children could have loads of fun and they could be creative. So our website is go-well.org. We created a character called Captain Taskavator, who is one of my colleagues. And he sets a challenge every week, but it's a problem-solving activity challenge with creativity involved. And me and my daughter Ivy do it every week, and we must spend at least an hour and a half solid on this challenge, and we have loads of fun together as a family as well doing that. So we've tried to, where we can, innovate and be a little bit different and look look at the problems that teachers are facing and parents are facing, and how can we provide a solution that will lift spirits and keep people moving and connected at home as well. So connecting parents with their children, siblings together. So some of the activities that we'll put out will be family activities, or you need to get somebody on Zoom, do this with you, things like that. So that's the type of things that we've been doing, but trying to always innovate and keep it new and fresh, because it's been a long time, hasn't it? So we've got to keep trying to bring out fresh ideas for people to get involved in.
And I think, yeah, and it has been a long time. It feels like it's maybe 2031, but we're getting there, you know. And I'm just thinking about that adaptability around and the stuff. I mean, I love seeing how I've been doing at Captain Taskavator tasks. But I'm just thinking about that idea, like around innovation and how things are moving on. And I'm just going to bring feedback in, because Fee's been working on, there's been quite a demand for technological solutions to quite a human problem. And I wasn't sure if you had a couple of minutes to talk about some of the stuff you've been doing with the app that you've been working on, and were you doing that before?
Hiya, sorry, I was just answering. I picked up what Stephen said there about engagement on, you know, whatever you're doing, learning. And sometimes we do too much, so there's this sort of shift from traditional and then sudden panic into digital. Now, it was sort of going that way anyway. It was definitely going that way anyway, but it suddenly happened overnight because of the urgency. And then people said, well, okay, I'll go digital, I'll do a Zoom. But that's obviously not going digital. So I think that panic over what happened, especially what Stephen was saying, is that all of a sudden they then do, obviously you're moving very quickly from that traditional environment into a digital environment. You've got to do what you can do, and then you can sort of get clever along the way. But as you say, they have too much of that, they'll disengage, because a lot of the problem is not just for well-being, but learning and development, is that it's not blended enough. So this lack of blending, so it's they're focused on the technology more than the methodology. So it's not a technology problem, digital. It's a case you've got to really change everything you're doing. So it has to be experiential, has to be very transformational rather than informational. So if we move information to digital, it becomes really boring, because now we just put something in between us and the participant, you know, which is another wall. We're losing a percentage of it. So engagement, bless you, Angela. So engagement goes down, or it can do, in the longevity of it. So so really what we focus on is really like, how do we make experiential learning go through all the blended adaptations, like micro coaching, mind hacks, and mixing it up. So you've got, like, when you do a Zoom call, you're having experiential learning, like you say, Sarah, which is really interesting, because she's focused on the kids and thinking games. Why are we not thinking play with the adults? You know, that should just be a given, because humans are something called neoteny, and neoteny means we're wired to play all our life through. And the opposite to play is depression, not work. So one of the fundamentals here is, it's not just a case of building in downtime, it's a case of building in not just time for us, but for more playful environments. So that should sort of be built into any development or well-being. So what we're also finding is that well-being and development are really coming together now.
I think,
so
just
I'm talking about
what you said there around play, and it's almost giving yourself and your staff permission to play, because we almost feel like it's something that we can't do, and once we're adults, when we're in work, we couldn't possibly have fun. So I think giving yourself permission and creating an environment where fun and playing is part of your regular weekly routine is fantastic for well-being and connection.
But as a group, Sarah, when you think about, you naturally doing that with kids, and everyone can go, oh, that's kids, of course she's doing that. But the thing is, if we don't bring this into a group type environment in the workplace, we're not going to get what we want, which is the outcome. Yeah. And so Stephen saying what you said is natural. That's what we're going to get, and the energy just goes further down and further down. And there's a really good guy, if you're interested in looking him up, called Stuart Brown, who's a neuroscience of play, and he's probably the top one in the world. And you can see his TED talk, it's got lots of stuff going on there. But he's got something called the Institute of Play in America. And they've done some amazing research on play and the damage if you don't do it.
And you know,
So,
I've seen
you know,
some fantastic stuff on. So one of the things that comes through quite a lot in lived experience work is the stress and the strain of just constantly doing serious stuff and having serious conversations. And there was a really fantastic, I think it's on TED, and I can't remember the name of the person, but talking about plativism, which is rather than activism. So rather than like trying to fight but to bring people into play and like to find those places in social action movements where rather than kind of marching, that you're doing something that's playful but has a point. And I think for those, when we're working in environments where what we're dealing with is really serious, it doesn't mean that we can't play with it. It just means that if we're going to play with it, there needs to be a purpose behind that play for it to be connected to our work and for it to be meaningful as well. And not to kind of assume that play is, like you said, the antithesis of work, because actually playfulness in work isn't just creative, but it's also productive. Like,
well, it gets faster learning outcomes. So your development outcomes, that's accelerated learning. So, you know, it's essential.
Yeah.
But it's always seen as work and play. No, we can't play, it's work. That's serious. They don't go together. Well, they do go together now. And I think that's got to be the next step. So it's easier for Sarah because you're naturally working with children. No one poo-poos that idea. And so they really have to change it in the workplace and pretty urgently.
Yeah, I think interesting that you said there, Vix, that play with purpose, because I also see a place for play without purpose.
Oh yeah.
And
yeah.
just free play and having fun together as a group as well. So I could, like, it's like Google, I think it was Google or some big company where they've got like slides in their office. Like, that's my ambition. I want to have an office with slides in.
I would love that. And I also want to have slides for the dogs in the office as well, because I don't think you can really have a dog friendly office if it hasn't got dog slides or equivalent kinds of toys. And yeah, I would absolutely agree about play without purpose. And I guess I'm thinking more specifically when we're connecting to work around stuff like mental health that we're working in, that you can play with purpose. It doesn't have to be either or. And I just want to come back to you, Hannah, though, because I remember doing the stuff in with you when I was doing my mentoring, and there was a lot of kind of just like lighthearted stuff that we would do around thinking creatively about things, and just it seems to be quite a core part of what you do, is finding that hook into someone that opens their individuality through their likes as much as through their stresses, through the work that you do.
Yeah, I think that so if I was working like therapeutically one-to-one or even in a workshop, when someone is sitting there and they're thinking, oh, she's going to ask a question, or there might be a test, or what does this, people associate the work that I do, that they think, oh, I saw a counsellor once, she might be the same as that. And that's where that your brain goes into that state of hypervigilance. So it kind of closes down your creativity, your decision making. It's the prefrontal cortex part of your brain. So you're not at your best. So lots of work that I do, whether it's using metaphors, is an absolutely fantastic one for connecting people with that kind of playfulness, where you're exploring, where you're going into something but you're disassociated, and that's where that your brain then becomes really, really calm, and you're operating from your dopamine reward center. So you are absolutely, that is when the ideas come, things that you've been really struggling with for ages just seem to be like, why didn't I think of that? And you couldn't think of it because your brain was absolutely under so much pressure that you weren't able to realize. You don't think, oh, I'm feeling a bit hypervigilant at the minute. You might feel a bit anxious, you might feel tight round your chest. But when you really let someone drop into that self, which has been hidden for quite a while through lots of stuff that's been happening, that's when really I think that the magic happens and people let go.
Yeah. And yeah, I'm mindful of the time because we've only got a couple of minutes left, and I think we've had I love the fact that what we've come around to has been play. Like, I think that's brilliant, and like individualness and finding our way to dopamine, which, you know, is great. And I just wanted to kind of, we've got a couple of minutes to close off, which isn't a lot of time, bearing in mind the number of people who are here, but I guess, like, for me, one of the things that I think's happened over the last year is really reflecting on how I use my time, and like how not to put as much pressure on myself, I think, to be using every minute of the day to do stuff. I think that's something that I've learned from COVID. So in the last few minutes, I'm going to fly around my screen for the speakers and just ask, like, if there was something that's come out of this just weird, unusual experience, like something really, really real that has changed over the last year? Like what's it been? I guess like maybe it's a bit meaningful for a 30-second flyby, but Steve.
Okay, off the top of my head, certainly in the summer, and to a lesser extent recently, I've learned so much about my local area from walk. Like at the first lockdown where you could only walk for like 20 minutes, myself and my daughter would do the same walk like once or twice a day, and I noticed so many things about the local area and spoke to people. I know half the pets' names in my local estate now, which I really love. And one thing I'm going to take from it, I want to do more local traveling, and I'm not all that bothered about going overseas again. Yeah, I think that's one joyous thing that I can think of.
That's cool. I like that. And probably for me too as well, actually, with the dog. I've probably seen more of my local area in the last year than in the 30 however many years I've lived here. Sarah?
So I think for me, it's probably cemented's not the right word, because I believe in growth mindset and always improving, but it's kind of cemented my leadership style and my belief in compassionate leadership, and having well-being at the core of a business culture. So well-being's always been at the core of our culture, and it's not something that's been new because of COVID and a pandemic and people being under more strain. But the having that as core of our culture has allowed us to navigate the pandemic in a more helpful way, I would say, and helped my team to navigate through that personally and collectively as a group. So I think the strengths of, I like strengths-based leadership and compassionate leadership, and also being aware that it's holistic. So everyone's got a part to play in well-being in an organisation, and every member of our team has contributed to helping each other through. So I think that's what it's been for me, just cementing that well-being is one of the most important things in an organisation. Having it core of your culture and making sure everybody is involved in some way is super, super important, and that will continue for us. And I would advocate it to any organisation that I talk to, or any person really, because we're all leaders. No matter where we are in an organisation, we can make a difference, and we can bring this empathetic, compassionate culture, and we can help to build it all together.
Totally, yeah. No, yeah. I compassionate leadership. I think I almost feel like jumping direct to Angela, because that's like her. It's your mantra. I'll come back to you, Hannah, but Angela, because compassionate leadership featured there, I'm going to come to you. What's the thing for you?
It is my thing, and I could say something really profound, but I just want to go back to that: be the change that you want to see in the world, because that's essentially what compassionate leadership is. And if we bring that back to play, well, sometimes it's the really small things at the moment. We have to stay connected with other people, which is hard. But for me, Zoom is a bit of a lifesaver. But also, what small things can you do for your well-being? Not the big things, not that it could take 20 minutes. And I'm just going to share one of the things that I've decided to do to show you how ridiculous it is, but it really helps. I can slide across the floor in my socks and get quite a long way. And for all the other stuff, I've realised if I do that every day, it's a little bit of a, oh, and sometimes the dogs join in. And I've realised that there are some socks that are much better at getting me further across the floor than others. So what are other things? Sometimes it's just the really small, simple things that matter, that keep us connected, that keep us playful and keep us smiling.
And I really treasure those things, and there's things like that, and I'm trying to think there's something, and I can't think what it is on the spot, but where I'll go, it'll only take us 2 seconds, I'm going to save that until after I've done this bit of work. I'm going to get this done, and then I'm going to do that, but yeah, I'm probably going to try and do it more often. I can't even think what it is now. It's something ridiculous, like it's probably Galaxy Minstrels, to be honest. I'm that easy. But Hannah,
yeah, I think that when we talk about being connected, I think that I'm more connected with my kind of community, that I now know all of my neighbours' names, that we do little doorstep drops for each other. And yesterday the water was off for 12 hours, and it was strange that automatically I knew that Pam was by herself, that she needed water. And I just thought, you know what, this time last year there'd have just been faces that I wasn't even really sure what house they lived in. And I have explored where I live, And even my house, I think that when I bought this house, that was at 100 mile an hour. And now I keep moving around different rooms and things like that. It's not a big, massive house or anything like that, but I keep like having a little move around and think, oh, right, I feel like I've got like something new to do, but I'm not. I'm just in a different room. But yeah, it's the daft things. I've got like kitchen dancing routines. And then I saw this thing where if you put washing up liquid on your feet, it was like a running machine. So I did that, which like I nearly broke my neck. But it's been a bit daft, isn't it? Been a bit daft.
It is. And, you know, one of the things that I've found, so I found that memes really kept me going during the first couple of months, just like as much of that as I could get really worked for us. And the other thing that I've really taken to is uninspirational quotes. Like I find that just like, it really sets me up for the day if I find a really good uninspirational quote. And with that in mind, I thought I'd leave us with one. So this is my favourite uninspirational quote so far of 2021, and it goes like this. Before you judge someone, walk a mile in their shoes. After that, who cares? They're a mile away and you've got their shoes. And on that note, I want to say thank you ever so much for joining us tonight. I've had a lovely chat. We've got another couple of webinars where we've got a webinar on Friday about peer training, and then next week we've got a couple more. They're on our Eventbrite page. We're all over time, so I'll not bore you with the details, but you can go on there and find them. Thank you so much to Steve, Sarah, Hannah.
Nice to meet everyone.
Thanks for being here.